I'll give an introduction about OET examination. OET examination actually started in Australia for the health professionals who are working there. It is very important to understand the healthcare settings of Australia because the questions are prepared in Australia, so they will prepare all the questions based on their settings. So even though the exam is conducted all over the world, the questions will be prepared in Australia. So that is why it is very important for all the students to learn this hospital settings. So I will start with the hospital organization chart. That is different levels of management in hospital. So there are different services within a hospital, as we all know, like administrative services where people related to the business are working, that is administrative services. Then information services, including the admission of patients, billing, and documents, and all these things comes under the information services. Then therapeutic services, including physiotherapy, occupational therapy, speech and language therapy, respiratory therapy, the medical psychology, social services, pharmacy, all this comes under the therapeutic services. Then diagnostic services like the patient consultation with the doctor, and then other services like medical lab, imaging lab, emergency medication departments, all this comes under diagnostic services. And other support services like what do you call the housekeeping, central store supplies, biomedical technology where you manage your waste and all things. Then maintenance section. These are coming under the support services. So these are the different services within a hospital, the administration services, information services, therapeutic services, diagnostic services, and support services. Now we will discuss about the organization of a hospital where the medical treatment or the diagnostic services are concerned. The top position in a medical department is a consultant. So the doctor, who is in the top position of a hospital will be a consultant. A consultant doctor would be a physician or a surgeon or a nephrologist or a neurologist or a cardiologist. So each department will have a consultant who is the top position of the medical intervention. So below the consultants, there are many associate specialist doctors who are experienced doctors supervised by consultant doctors. So associate specialist is a doctor who is supervised by consultant doctors, and they are also highly experienced, but they comes under these consultants. So another group of doctors called staff grade doctors who are also providing support to the consultants, so directly supervised by the consultant, but they will come under the associate specialist. So they are called staff grade doctors. Now, below the staff grade doctors, it comes specialist registrars. So a registrar in a department, a registrar in an emergency department means he's a doctor. A registrar is a doctor who is undertaking higher specialist training. So to become a specialist, those doctors who are taking higher specialist training are called specialist registrars or registrars. So especially in your OET exam, as OET writing, they will ask you to write a letter to registrar of cardiology department. That means you will be writing to a doctor who is undertaking higher specialist training. Now, below the registrars, the senior house surgeons or house officers, senior house officers, those doctors who are undertaking basic specialist training are called senior house officers. So, below the senior house officers, definitely the newly joined or newly qualified doctors who are also called house surgeons or house officers. So below the junior doctors is a very important position of a nurse who is called nurse specialist, clinical nurse specialist. So a nurse specialist means some nurses are trained to undertake some of the work traditionally done by some junior doctors. That means a nurse specialist can consult patients and also they can prescribe certain medications, not all medications. So nurse specialist will have their own formulary, like it is called NPF, nurse prescribers formulary. So that is a book which contains what are the condition of a patient. You can nurse specialist can treat a patient, and according to that NPF, nurse specialist can prescribe medications. So those patients with lesser concerns or issues can be treated by a nurse specialist, but for higher evaluation or higher assessment, the nurse specialist will send that doctor to registrar or specialist or consultant according to the severity of the patient. So the organization chart of a hospital, like the top position, I mean the diagnostic side, the top position is a consultant. Below the consultant, there are associate specialists. Below the associate specialist, there are staff grade doctors. Then comes then specialist registrars, then senior house officers, and at last the clinical nurse specialist, or simply call it a nurse specialist. So nurse specialists are some nurses who have undergone further training, maybe another 3 years of training to become a nurse specialist, or sometimes they are called nurse practitioner also. So that is the organization setting of a hospital. Now we will discuss about the primary health team in Australia or in New Zealand or in United Kingdom or in Ireland. So the primary health center, which is also called general practice, yeah, short form is GP. So general practice means it is a primary health center. This is also called surgery. Some in some areas it is called a medical center. So these are all different names for PHC, primary health center. So they normally call it as GP or surgery or medical center or the medical. It is also called clinic, the medical clinic. So these are different names for GP. And within a primary healthcare team, the top position is a doctor who is also called the GP, that is general practitioner. So a doctor who is working in GP is also called GP, a general practitioner. And general practitioner is the first point of contact for any person or any patient who comes to that primary health clinic. So there are many nurses working under general practitioner. The top position of a nurse in a general practice or GP is called a practice nurse or nurse practitioner. Both are the same name for those nurses who are working under general practitioner. So nurse practitioner or NP are registered nurses, and they can prescribe medications according to NPF. So same like nurses working in hospital, the clinical nurse specialist, those nurses working in primary health center is called practice nurse or nurse practitioner. So the same nurses working in hospital, they are called clinical nurse specialist. Both of them are in the same grade. Uh, they are all registered nurses, and they work directly associated with the general practitioner, or if it is in hospital, they work under the consultant of the concerned department. So nurse practitioner, they can consult patients and they can prescribe medications. Same like the clinical nurse specialist. For each department, they will have clinical nurse specialist in the hospital, OP clinic. So there are a team of nurses called district nurses or community nurses who are also working for the community. Community in the sense, same like our village. They call it as community. So community nurses or community health nurses or district nurses, these are all same name for these nurses. Uh, these are all same, district nurse, community nurse, or community health nurse. They are registered nurses. So district nurse in the sense the country, if you take any country, Australia or United Kingdom or Ireland or New Zealand, the country is divided into health districts, not the governmental or I mean the geographical district. The health district, and each district has many nurses working for the community. They will not work in a hospital or they will not sit in a primary health center. They will work within the community. Means they will visit each patient at their own residence. They will visit patients' home, or if old age people who are living in care homes, these community nurses or district nurses will visit the patient where the patient is residing. And they will do follow-ups as instructed by the GP. So if GP, the doctor wants to meet a patient or to do a follow-up for a patient, they will send the community nurse to the patient's house to do the follow-up. And these community nurses or district nurses will supervise the staff nurses who are working under them in the primary health center or clinic. So the other staff nurses and nursing assistants who are working in primary health center, they are supervised by the community nurse, or they are called district nurses. So so far we are discussing about the primary health center. The top position is a doctor who is also called GP. Under the GP, there are NP, which is nurse practitioners. Then below them, there's a group of nurses who are called district nurses or community health nurse. These are all same name for these nurses. Then under the community nurses, there are other group of registered nurses called health visitors. So health visitor is also a registered nurse who are dealing with the social work. So mainly they will do kind of counseling and all. They will not do any hand-on nursing. Suppose the health visitor visits a patient at a patient's house and they find that person needs some kind of nursing, maybe a dressing change to his wound. They will just notify it and they will communicate it back to the community nurses. So health visitors, even though health visitors are nurses or registered nurses, they will not do any hand-on nursing. So they will instruct the district nurse or community nurse to come and visit the patient and do the dressing. So they will do all types of counseling to the patient. What are the requirements of the patient? They will do those counseling, especially the child and mother and old age people. They will always visit their houses once in a week or once in a month, so that to make sure that the patient is okay with that atmosphere in their house. So especially mother and child, when a newborn baby or a mother after delivery, they will visit the patient at their own houses and they will check whether they are living in a safe atmosphere. They will do the counseling only. And if there is a requirement of nursing, they will inform the community nurse, and community nurse will come and do that nursing. So there are community midwives who are also working within the community. So the community midwife need not be a registered nurse. So sometimes they will undergo a 6 months or 1 year course to become a midwife, and they work for the community as community midwives. So all other positions what we discussed so far, they are all registered nurses, but community midwife is not a registered nurse, and their duty is to help with pregnant women, and at the time of discharge they will do the support to the mother and baby, and they will also escort the patient until they reach their home. So pre-delivery and post-delivery, these midwives will help those pregnant women. And one other responsibility of community midwife is to promote at-home deliveries. So at-home delivery means if the first delivery was normal, they will tell the woman to have or to conduct the second delivery at home. So they always promote at home delivery, because everything is within their reach, within their reachable distance. Like if there is any emergency, they will be taken to the hospital within 5 minutes. Like even the helicopter ambulance also is available in the community. So there is no risk of having a delivery at home. And even if the first case was normal, definitely they will counsel you, or they will help you to have the second delivery at home. So those are community midwives, normally deal with pregnant women and the mother and baby after delivery. And there are also community mental health centers where the community mental health nurses are working. And they are also liaising with the people who need mental support, bipolar patients or depression patients. And they also they work together with criminal justice system of the country, and psychiatrists, psychologists, and social workers. They are all working along with them, the community mental health nurses. So, so far we were discussing about the primary healthcare team, where you will have a surgery which is called a GP, or which there's a medical center, or you can call it as a clinic, where the general practitioner doctors are working. So within a GP, there will be 6 or 10 doctors who are all GPs. And under the GPs, there are practice nurses or the nurse practitioners. Both are same. Practice nurse or nurse practitioners. They are all registered nurses, but they studied further, maybe another 3 years to become nurse practitioner, and they have the power, or they have the authority to consult a patient and to prescribe medications to the patients. And there are within the GP, or working along with the GP, there's a community health center where the community health nurses or community nurses or district nurses are working. So the nurses who are working in a community health center, they are all registered nurses, and their primary responsibility is to visit the patient at patient's house. The patient will never visit community health nurse. The community nurse will visit the patient at patient's residence to do the follow-up as instructed by doctors, the GP doctors, or even from the hospital doctors. And on call, like suppose those who are living in care homes, especially the old age people, and the carer or nurse who is working in the care home needs the help of a nurse, then they will call the community nurse to have a visit and meet the patient who is living in that care home. So that is the responsibility of community health nurses or district nurses. Then there are a group of health visitors who are also registered nurses, and they are mainly doing with the dealing with the social work related aid, the help, support for the patient, and they will never do any hand-on nursing. They will uh, they will just do the counseling. They will counsel the patient and find out what are the needs of the patient, and they will inform the community nurse or the GP that this patient requires this type of support from the community center. So they are all registered nurses. Then comes the community midwife. But midwives need not be a registered nurse, and yeah, they normally help with the pregnant women, and they promote at home deliveries. And there is a community mental health center with they are called the community mental health nurses. They liaise with the criminal justice system of the country, and also they liaise with or work along with psychiatrists, psychologists, and social workers. So now we will discuss about a nursing department in a hospital.